Scan the room. Okay. Knock, knock. Provide privacy. My name is Teresa. I'm a CBCC nursing student, and I'm here to do a head-to-toe assessment on you. Now, can you please verify your first and last name and date of birth for me?
Yes, Shabria Stapleton, 12/9/93.
Okay. Do you have any allergies?
No allergies.
Okay, great. So like I said, I'm gonna do a head-to-toe assessment. Just gonna assess you from your head to your toe. Before we do that, I'm gonna go ahead and verbalize your vitals. Blood pressure is 125 over 50. Heart rate is 65. Respiration 18. Temperature 98.2. Are you in any pain or anything?
No.
Okay. What's today's date? What's today? The day of the week?
Monday.
Okay. And the president?
Joe Biden.
Okay. And where are we?
The clinic.
Okay, great. So my patient is alert and oriented ×3. She is addressed appropriate for the situation. She answers questions appropriately. She's sitting is erect. Her posture is erect. I'm gonna go ahead and provide hand hygiene. Wash my hands. I'm gonna start with your head. There's hair is evenly distributed. There's no dandruff or lesions, no masses, no. Let me know if you feel any tenderness throughout this assessment, okay? So I'm gonna go ahead and do the ears, the auricle, the tragus, and the lobes. The mastoid process, no tenderness, right? Okay, I'm gonna go ahead and do the cervical lobe and the occipital lobe, the submandibular lobe, submental, no tenderness. Okay, no tenderness in none of those lobes. The trachea is midline. That thyroid is not enlarged. Temperature is warm, dry, and intact. Skin tugger is good. I'm gonna go ahead and don my gloves. Okay, the ears are symmetrical, no drainage. Go ahead and do the eyes. Okay, follow my light. Okay, let's follow this. Eyes are perla. Cranial nerves 3, 4, and 6 is intact. We'll go ahead and do your nose. Nares are clear. Go ahead and hold one side for me. Breathe in. Do the other side. Breathe in. Nares are clear. Patency. With patency. Go ahead and open up for me. The lips are dry, moist and intact. There's no lesions. There's no cavities. Tongue, no signs of dehydration. Buccal mucosa is moist and pink. There is distinction between the soft and hard palates. The uvula is midline. Go ahead and raise that tongue up, down, round and around. I'm going to check that gag reflex. Okay, cranial nerves 9 and 10 are intact. I'm going to go ahead and feel this nose, no tenderness. Okay. Conjunctiva is pink and moist. Those tonsils were, there was no extra date on the tonsils. And let's go ahead and do, don't let me push down and push up on my hand. Okay, so resistance in the shoulders is good. Cranial nerve 11 is intact. Let me go ahead and I'm gonna listen to your heart, your breath sounds, your heart. Go ahead and take these off for now. Okay, so I'm gonna just go ahead and listen to your breath sounds. Okay, breath sounds are clear. Go ahead and listen to your heart. We're gonna start at the second intercostal space on the right. Breathe in. Second intercostal space on the left. The aortic, pulmonic, third intercostal space on the left at Erb's point. The fourth intercostal space, your tricuspid valve. And the fifth intercostal space at the mid-clavicular line at your apex of the heart. The heart sounds are normal with no murmurs. I'm going to come around to the back and listen to the lungs. Well, before I do that, let me go ahead and finish the chest with the percussion. The chest rises and falls evenly. Skin is warm and dry. Skin tugger is good. No lesions. I don't feel any masses or anything. Resonance is noted. And then so I'm going to listen to your lungs in the back here. Breathe in. Okay. All lung sounds are clear. No crackling bilaterally. There's no accessory muscles being used. Scapula rising falls evenly. Skin is warm and dry. There's no lesions or masses. I'm going to come behind you now. Check. Okay, so can you bend over just a little bit for me? That spine is straight, no curvatures, no scoliosis. I'm going to go ahead and percuss. Okay, residence noted. I'm going to go ahead and let you lay down for me. But before we lay down, let's see those arms. Up, down, round and around. Okay, and do this for me. Push, pull, squeeze my hands. Okay, strength and range of motion is good in upper extremities. Brachial and radial pulses are +2 bilaterally. The palms or no lesions. They're warm and dry. Capillary refill less than 2. Temporal pulses. Elasticity is present. 2+ bilaterally. Carotid or palpable. +2 bilaterally as well. Listen to those carotid artery. Okay, equally bilaterally. All right, let's go ahead and lay down for me. Okay, I'm gonna go ahead and check the abdomen. But first, we'll do the breast. You want to check start from under your arm and all the way around. I want you to also do breast exams in the shower 1 week after your menstrual cycle. Note any masses or drainage from your nipples. Please let your doctor know, okay? The abdomen is flat. There's no lesions. Go ahead and listen to those bowel sounds. Okay, bowel sounds are present in all 4 quadrants. There's no masses or lesions, hollow sounds in all 4 quadrants. Okay, I'm gonna go ahead and check the vagina at this point. Um, the hair is evenly distributed. There's no lesions or redness on the inner or outer labia. Um, there's no odor or drainage. Also, let your doctor know if you ever have any of that. When was your last bowel movement?
This morning.
Okay. Rectum is good. Was it formed in? Okay. Rectum is good. We're gonna go ahead and check those femoral arteries, popliteal, and cross your legs for me. Popliteal, posterior tibia, the dorsal pedia. All pulses are equal and bilaterally +2. Go ahead. Capillary refill in both toes are refills in less than 2 seconds. Okay, let's go ahead and lift this leg up, down, try to push, okay, do it again, and up and down, okay, just do those feet in a circular motion for me. Range of motion in the lower extremities are good, skin is warm and intact, there's no lesions or edema, skin tugger is good. One more, let's stand up for me. And I want you to walk over there for me. And come back heel to toe for me. Okay? Balance and coordination is good. And just turn around for me. Cover one ear. And I'm going to whisper a word. And I want you to repeat it for me.
Baby.
Okay? Other ear.
Bottom.
Bottom. Okay? Hearing is intact bilaterally. Let's see. Just making sure I didn't miss anything. Do you have any questions? Okay. Again, just double checking, making sure. Okay. You did good. Everything sounds good. So we'll send the doctor in shortly. I'm gonna let my bed down. Make sure the bed's okay. Okay, and then I will do my documentation. Oh, perform hand hygiene before that.